By request of the meeting organizer, this meeting is being recorded.
18th office hours for the EndDisparities Learning Exchange entitled Helping Consumers Understand Baseline Data. I'm Michael Hager with the National Quality Center, and the time is just after 1 p.m. Eastern. So let's go ahead and get started with today's office hours conversation. Before we start, one of the things that we normally do with a larger group is to enter our name and information in the chat room. But with such a small group on the line today, I thought maybe we could just take a moment to do this out loud, because why not? I'm Michael Hager with the National Quality Center, located in New York at the World Trade Center. I'm the Manager of Technical Assistance and the Program Lead for the EndDisparities Learning Exchange, and I'm really glad to be on the line with you today.
Fantastic. My name is Renatus Jones, and I'm the Regional Consumer Quality Representative for the Kansas City region. And I am calling out of Kansas City, and I'm happy to be on the line as well.
Welcome.
Hi, I'm Nishi Parkinson. I'm from St. Louis, Missouri. I work at Project ARC, Washington University School of Medicine. I am the consumer liaison for the Missouri region, and I'm also the spokeswoman for the end+Disparity campaign. And the population that I am targeting is Black women.
Wonderful. Thank you so much for joining us, also Nishi, and thanks for being a co-presenter with me today, or facilitator, because we don't really have a presentation in office hours. It's just about discussion among folks that dial in, but thank you very much for being a co-facilitator with me today.
My pleasure.
I believe there's one other person on the line. Christine, can you introduce yourself? Okay.
Hey, can you hear me?
Oh, hello.
Hi, sorry, I'm having technical difficulties, but this is Christine Kibui, the clinical quality management nurse for Ryan White Part B in California.
Thank you so much for joining us, Christine.
Thanks for having me. Absolutely.
Now, for everyone on the line, you're familiar with the Learning Exchange, but for the benefit of people who might be watching this recording later, the EndDisparities Learning Exchange is a 9-month initiative that promotes the application of improvement interventions to reduce HIV-related disparities in our 4 subpopulations while building and sustaining a community of learners among Ryan White HIV/AIDS program recipients. The Learning Exchange offers a number of informational opportunities to connect content experts with the Ryan White HIV/AIDS program community and utilizes the power of peer learning to facilitate local improvement efforts. This is an office hours experience, which is something that is meant to be an informal discussion among the people who dial in, and hopefully the folks who are watching this recording later can benefit from the discussion we're having, in addition to thinking critically about these issues as they are applied in their own settings, whether they're consumers or providers or some other stakeholder in the broader Ryan White HIV/AIDS program system. In addition to these office hours, we have special webinars for consumers called Partners in Care Roundtable discussions. And we also have overarching webinars that are intended for the entire EndDisparities Learning Exchange audience. For more information on all of our events, you can visit our website, www.endDisparitiesExchange.org. One of the things that we have and this is just a reminder, as a way to spread the word about this initiative is our video, which is located on our website. The video covers some of the reasons why we're doing this based on findings in the literature. So we encourage you all to go to the EndDisparitiesExchange.org website to check out the video, or you can see the direct link to our YouTube channel and its location there here on the screen right now. Just to let you know a little bit more about office hours, as I said, they are open-ended dialogue to explore specific topics. We're looking for some general question and answer and interaction among our folks who have dialed in around our topic. Our office hours always occur on a Friday at 1 p.m. Eastern. It's a variable schedule, and so we really highly encourage you to check out our website, EndDisparitiesExchange.org, and to look at the calendar to find the office hours events that are most relevant to your work, and the things you're trying to accomplish in your clinical quality management program as it relates to disparities in HIV health outcomes. And today's topic is helping consumers to understand baseline data, a very important topic considering that we're trying to engage as many consumers as possible in the discussion. And in the name of full disclosure, I myself am a consumer. I've been living with HIV for 14 years, and in wearing my dual hats as someone who is a care recipient and also involved in helping care providers, I can say that from both sides of the fence, like one of the most important aspects of our work in clinical quality management is to involve consumers. And the first step is helping consumers to have a strong understanding of the basis of our decision-making process as it relates to data. So in thinking about the way that we are talking about data, Nishi, I was wondering if maybe you could walk us through some of the conversational questions that we have around this topic, and maybe we can start a discussion among the participants on today's call based on some of those guiding questions that we came up with.
Great, Michael, a great segue. Can someone tell me who on the call has shared data with consumers in the past? It could be the past 30 days, or 6 weeks, last year.
I have Renata Jones from Kansas City. I've shared some data here recently in October with some consumers at a monthly meeting.
Okay. How did they adjust or adapt to the data that they were receiving in that meeting setting? Was it relevant to them or not relevant to them?
It was extremely relevant to them, but I think that they were, throughout the conversation, they had more questions, you know, basically like surrounding where we got the data from, how many patients was considered, and it's some very specific questions, just depending on the topic that we were talking about.
Okay, great. Anyone else on the call? And Michael,
Hi, this is Christine. Unfortunately, we haven't shared with consumer any data with consumer recently.
You say you have or you have not?
We have not.
Okay. Okay.
Just to dig at that a little bit deeper, Christine, is there a reason why? Are you in transition with your data, or is there a concern that maybe folks won't understand or how to interact with the data? Or tell us a little bit more about that.
The simple answer is we have not mobilized our consumers yet around our quality management. So the only consumers I can say that have gotten data is through our planning group, California planning group, that has consumers in it. So they do get data in that sense, but in the broader sense of just general consumers, not necessarily in the planning group, we have not mobilized that yet. It's in the, which we're working on that.
I think that that's a really important distinction to make, Christine, and I think that that might warrant a little bit of conversation here in terms of, you know, we're talking broadly about sharing data with consumers, but, you know, what does that mean? Are we talking about data that we just kind of push out all the time to consumers, or are we talking about sharing data with consumers that are part of a dedicated team like the Community Planning Group of California? Nishi, what's your sense, as someone who is also a consumer like me, who is part of the field and part of the industry, what are some of your suggestions around the types of data that could be or should be shared with different groups of consumers, including those who are formally part of a group, like our Partners in Care architects, or people who are maybe just users of the system but not really formally engaged on a higher level with designing care systems?
From my perspective, I think that helping the consumer really understanding the baseline data of where that data is coming from, just really starting at the simplest form with utilizing the great wealth of knowledge that the National Quality Center has provided us over the last several years would be helpful for individuals who have not mobilized their consumers in the way that they would like to use them in their communities moving forward. So I think it would be best for Christine to look at some of the tutorials that are best available for the beginning stages of getting the consumers involved, such as the training consumer on quality, to find out if there's someone in your state or your region who has already went through the actual training who can build that capacity in the way to mobilize the consumers at the planning stages of quality and of data.
Yes, thank you. And I have to clarify that the RINB, as a RINB recipient, the California Department of Public Health does not provide direct services. We have consortia and contractors that provide these services, and some individual contractors may actually be providing data to their consumers they directly serve. But again, at a statewide level, we still haven't mapped out how that looks like.
That's really interesting. And, you know, California is such a big state with so many people in so many different regions with different issues and interests. Yeah, it would be really neat to hear, you know, if you do have a discussion with those contractors, you know, kind of just to take, you know, the pulse of what's happening across the state. There are many states like yours that are just huge, that have a challenging time in terms of thinking about an overarching statewide process for this. And if there's not a statewide consumer advisory board, which most states don't have anymore, then it's hard to do it from a statewide standpoint. And that's also not even how you're set up, as you pointed out. So have you considered, or maybe this is just something to chew on, you know, like kind of reaching out to folks and to just kind of take that pulse to see, you know, what that landscape is like across the state. You might be able to find some best practices that one of your subcontractors for one of your consortium regions could lend to another one of the subcontractors for another one of your consortium regions. What do you think?
Hey, absolutely. You raise a good point. So as we are in the process of revamping our clinical quality management program. So there are so many things that are taking priority that consumer involvement is one of them, but we haven't even gotten to how that looks like. So this is something that as I'm reaching out to our sub-recipients, I will be looking at as the point as you've given me a very great. So I'll start looking at what exactly is being done right now and see if I have any best practices that I can adopt for the whole state.
Cool. And to Nishi's point, there are a number of resources that the National Quality Center can use to interact, or that you can use to do this type of growth for consumers once you have a sense of that. And we're going to walk through some of those toward the end of our discussion today, just to give you a sense of how to find them.
Awesome. Thank you.
And Nishi, I don't want to steal your thunder, but I noticed that we had another person join. Welcome, Sandra. Thanks for joining us in today's office hours. How are you?
Good. Thank you for giving this opportunity, because I wasn't able to attend yesterday's webinar, so I'm excited. A little late that I joined, but yeah.
Oh, that's no trouble.
The discussion.
Thanks so much for joining us. I'm just wondering if you could let me know a little bit about where you're calling from and your role in the Ryan White system, so that we can have the best possible conversation to help each other all out today.
Well, I come from Howard Brown South in Chicago.
Wonderful.
I'm the new Quality Improvement Coordinator. I just joined a month ago the organization. Although that I have previous experience, I didn't have experience in primary care and the way that as a federally qualified health center, I was assigned to begin to participate in EndDisparities, so I attended the first one last month, which is really interesting. And I was expecting yesterday's webinar to begin to understand better the purpose, and especially because it's the baseline data, how I could, as a quality improvement, could help our programs in the organization to be more able to set up and use your calculator or the calculator. And so sadly, I was attending another meeting yesterday, but my idea attending today is trying to figure out what happened yesterday on what is important, so I could begin to set up what it is needed to calculate and on the subgroups that we serve, because here in Howard Brown, we work with the 4 main subgroups that this initiative has, so yeah.
Fabulous. I think that we can definitely, at the end of today's webinar or discussion, take a moment to show you how to access the tool and to play with the tool together and see if you have any questions about that.
Perfect. Thank you so much.
And just before we move on, Nishi had, just as you were joining, Nishi had asked the question of the participants, have you shared data with consumers at Howard Brown in the past?
We prepared an impact report, and since I've been practically new, I don't know how it is, the relationship with the consumers, but I do know that it's being widely used and very informative. So yeah, and I'm pretty sure that most of the measures that we are expecting to calculate the services that you provide, we've been previously providing some information on those subgroups. We just want to be doing it the best way possible in order to take advantage.
Thanks so much. And Nishi, back to you.
Thank you, Michael. Moving on, what are some of the common issues that arise when we share our data with the consumers that we service?
I think Renata had some great ideas already. Oh, sorry, go ahead.
Yeah, I was actually going to say that I think that just their lack of understanding of it, data is very tedious. And just, I think that one of the more difficult problems for my consumers is getting them a clear understanding of what it means specifically to them, if that makes sense.
Yes, it makes perfect sense.
Okay, yeah,
I would say,
oh, go ahead.
Oh, no, I was going to echo that and say I would anticipate trying to figure out the relevance of the data. How would I know what's relevant data to the consumers?
Excellent.
Right. I agree with you. Because when we're talking about, like, adherence and consumers that are taking their medication and people that aren't, or if we're gauging quality on, like, how to get the most out of your visits with your provider, it's more relatable to them then, but they always tend to turn the tables back and say, well, you know, I go to my appointments, I take my medicine, I do everything I'm supposed to do. So, you know, when you see the gap of people that are not suppressed and things like that, then they just tend to dismiss it because they don't think that it applies to them.
Mm-hmm.
So,
really important points there.
That's a really important point, because a lot of times individuals come to their medical visits and they don't know what the CD4 is, viral load should be, and they don't know how they fall in the categories of how we look at data over a period of time and how we notify or are being brought to fruition of the different trends. based on the different populations, like the MSM population, women of color, trans. You know, how do we actually look at the data to get those percentages over a period of time, or how do we get the aggregated data for youth living with HIV from ages 13 through 24. Some people feel that they don't fall in that category because they may not identify as a youth, and they want to identify based on their sexuality or race or things of that nature too as well. So I guess starting at the bottom and working your way up will reduce the common issues over a period of time. Anyone else?
Andrew, you said you're new in your role. In previous roles, have you ever had this type of interaction? And it doesn't have to be Howard Brown specific, but any interaction with people who are consumers of services and trying to share data, and what some of the problems or the barriers have been to doing that, like in terms of getting them to understand and interact?
Well, previous joining Howard Brown, I was the director of 2 programs funded by SAMHSA, and although that we don't actually share data with the consumers, we share data with our collaborators and partners in order to show the importance of our collaborations. So looking into what the center is been doing, it wasn't like this, especially like it was a small non-for-profit, so you know you cover many hands. But yeah, I will always, when sharing the information with my collaborators, what I always try to is like show them the total number of people that we were serving, the people that we were serving at their centers or their location, and in what ways like different subgroups would be benefit and how they distribute among our population. So it wasn't like specifically by this group, but definitely depending on the needs that were served, including like homelessness and other issues that were for those programs important. Since I wasn't dealing with consumers, I don't think that there was a bigger issue. Like usually the people that were dealing understand probably due to their responsibilities data, but I haven't had that opportunity yet.
I think that's a key point, that, you know, consumers are another type of stakeholder. And, you know, you're talking about general presentations to stakeholders in general. And, you know, I think that this is something that, you know, is kind of a eureka moment sometimes for me, you know, or a reminder that, you know, consumers are stakeholders, and, you know, the same type of questions or concerns that you would ask, you know, yourself in preparing a presentation for any stakeholder, you know, the points that you mentioned about how to define something, what's its applicability to our work, our mission, our vision, our goals. You know, these are important things to keep in mind, and you usually have to think about this from the perspective of the stakeholder group you're presenting to, right? Like, you need to understand, like, okay, so these are policymakers. What do policymakers want to know about, and what are they getting excited about? And consumers, similarly, what do consumers? You know, so it's a different set of answers, but that process and that line of questioning is very similar.
Yes, definitely. I think that although in some of the presentations that I've done previously in the past, depending on my on the people that will be attending, I will always try to set up the information that is for them to relate better. So I believe that what we're discussing right now, you're trying to evolve, but also I do understand that for some people it's harder. In terms of, like, there's some of us that are more easy to go with data, and there's people that are, like, found this a little more complicated. It's just put it in a way where they could relate to what we're discussing.
Yeah, Sandra, that goes back to what Renata said, you know, trying to bridge the knowledge base so that they won't feel like they have a lack of understanding. How do we get them to understand better apples and oranges as it relates to data, and understanding how important it is for us to have this data and what we can show over a period of time?
Right, I agree with you. I think that it'll be helpful, but just the introduction to data, you know, and letting them know that this is how we do segue into trends, like you said, Nishi, and just give them that foundation. Then I think over a period of time that they should come around to appreciate how decisions and things like that are made and trends are respected, and how it's viewed from a whole instead of like an individual base, if that makes sense.
Yes, Renata, yes. Making it a group effort versus making it an individualized effort to see how well people are doing over the period of time in group settings. Especially to keep the collaboration with the funders or the subpopulations or sub-grantees to make it a win-win situation so that they can see how effective consumers are doing at the forefront for its medical frequencies, for its visits, adherence to medications, and things of that nature.
I put up a slide here that I think is a helpful way to think about this in terms of any type of data display or presentation to any stakeholder. You know, I think that, you know, this diagram in terms of interestingness, integrity, form, and function when we produce any type of data display is a great way to keep our feet bolted to the floor. Because there's a number of ways that you can talk about data and show data that range from providing a handout with a couple of numbers in bullet points to an infographic, you know, on the opposite end of the spectrum, something that's more, you know, meaty and, you know, people can kind of like find something that speaks to them within that data. I know that it's kind of a leap to get here from talking about just baseline data, but since we're talking generally right now about helping consumers gain understanding, feel comfortable and secure, and also comfortable and insecure in what they don't understand. That's one of the biggest problems with human nature, right, is that we're not always willing to say, I have a question because I don't understand this. You know, like thinking in terms of the way that we share data that lets people feel comfortable in asking questions and not anxious and insecure. I just wanted to share this one image with you while we continue our discussion here.
Thanks, Michael. I noticed that we have Chuck on the line with us. Chuck, if you can unmute your line and give us the name of the organization you're from and the city or state and what population you have as a target population or what your job title is, please.
Chuck, your line may be muted locally. I saw that you unmuted your line within WebEx, but you might have your phone on mute. Uh-oh. We cannot hear you, sir. But to echo Nishi's sentiment, welcome, and thank you so much for joining us today. I hope that you're unable to mute your line so you can join the conversation, the dialogue that we have going here later on.
Okay. Have anyone sent the consumer to the NQC Trainers Consumer on Quality or the TCQ Plus recently? And if yes, what was the experience that they received?
So it sounds like we haven't had experience on the line around the TCQ. Let's circle back to this one, Nishi, because maybe we can have a conversation about the TCQ and its benefits once we start showing how to access that information and where to find it on the NQC website.
Perfect, Michael. Are there any other solutions that have worked for folks on the call as it relates to consumer involvement for quality that you can bring as a momentum or to the forefront?
And especially thinking about like helping to bridge that gap to foster discussion. How do we improve understanding? How do we improve relevance to consumers? How do we show the application of our work for consumers?
Michael, one thing that I can say is here in Missouri, we have a Missouri statewide response team that has 3 phenomenal consumers sitting at the table, working together to understand the data that we look at on an ongoing basis. And just to have the repetitiveness of learning together and revisiting things over time has been very helpful to the solution of understanding how important consumers are needed, their voices are needed, and to be able to understand the baseline data to make it fit in us having accountability for the people that we're servicing as well as ourselves.
I think that is an awesome point, Nishi, and it definitely reflects the experience of other jurisdictions that and groups that have started to bring more consumers to the table. You know, oftentimes people say that when they join one of our NQC collaboratives, it feels like it's trial by fire, you know, and when you have a group of people who are all learning and growing together, especially when they have the same starting point, you get some really strong bonds among the members of that group. And some of those issues around anxiety and insecurity about asking questions fall away because people feel like, nah, these are my people. That's an awesome point.
And just having acceptance over a period of time, because we know in our communities as a whole, stigma plays a big part to allowing people to come to the table. So I am so forever grateful that the National Quality Center has done great work on the ground as well, Michael, to kind of offset the stigma around persons living with HIV and just bringing it to fruition and to the forefront where we can thrive as individuals and say it's okay that I don't know, or it is okay that I do know, or how can you best help me get to this point of understanding?
Well, thank you, Nishi, and I agree, absolutely. Hey, I've noticed that Chuck has dialed back in. Chuck, can we hear you, sir?
I think so. Can you hear me now?
All right. Yes, welcome.
Great, great. Thank you. Good to be here. I apologize. I'm doing a site visit, so I tried to steal away and find a quiet spot to join you for a few moments.
Well, thanks for joining us. Just to echo Nishi's point earlier, can you just tell us a little bit about where you're calling from and, you know, what some of your experience has been in sharing data with consumers in the past, just so that we have a sense of who everyone is on the call?
Sure, sure. So I'm Chuck Colasar. I'm the Program and Quality Manager for Ryan White in Memphis, Tennessee. And yeah, we've done some work. I've been here in Memphis for a year working with this group. And I think really one of the things I've tried to do is just kind of help the people living with HIV and AIDS to become more comfortable with the quality improvement process. So we've done some training around that with my consumer input committees and the Planning Council, so they're more comfortable with just some of the techniques that we utilize and the language and that kind of thing. So they really don't feel, you know, like it's something beyond their grasp. They can certainly do it. And in fact, and of course, sharing data, we do our presentations to the Planning Council. I do the same presentation, like our needs assessment, to consumer input committees. So they really have a good handle on data, and we just spend whatever time we need to be sure that everyone understands what's going on in the community and with the epidemic at large.
Great, thank you.
Great. Oh.
Hey, Michael.
Yes, sir.
I did want to share, too, that we utilized the disparities calculator.
Yeah.
And I did it for the Quality Management Committee, but I also did it for the Consumer Input Committee. And it really generated a lot of discussion along, especially from the consumer group, along some of the things that they felt like providers could do to help to, close these gaps and disparities. So it was really a very useful tool. It really generated a lot of excitement and discussion.
That's amazing. Thank you so much for sharing that.
Sure.
So are the consumers in your area trained in quality? Have they gone to the TCQ, or have you provided other training to them that you developed locally to help them engage on this level?
Now, we have individuals who have been identified that want to participate in that training, the TCQ and the TCQ Plus training. So they're really excited about upcoming trainings. But what I've been able to do locally is just do some basic training with the whole group.
Wonderful.
And we also have created a PDSA with the consumers. They are driving a PDSA now that has to do with, it's a retention study having to do with encouraging consumers to ask questions when they have medical visits, and hoping that, that process of becoming more engaged in their own care will help them to be more retained in care.
That's really exciting. You're activating those patients. That's wonderful. Okay, can I ask you, when you shared this calculator with consumers, what was their response in addition? Like, was there a reaction at first? Like, were any nervous about this calculator and what it had to show, or were there questions or concerns about where the data came from, or how did you manage that discussion process?
I think we kind of, because it was the second time I was able to, run through it, because I did present it to the Quality Management Committee, and some of the consumers were in both groups. I think there was just a lot of shock, because we did, we identified the particular disparities for viral suppression, for example. We know we had some really low viral suppression rates among our transgender population, but also among our youth. Those were two areas that were really significant. And that was, I guess, that youth component is what really generated the most conversation in that group, because there's a lot of older individuals in that group that have been around for a while, and they recognize that they play a role in trying to help younger people, navigate the Ryan-White and treatment and care. And so they're wanting to, kind of step up and take a larger position in that kind of relationship, trying to mentor younger folks and to educate them and to try to, keep them in care.
That sounds like a challenging but beautiful conversation where you have, the elders of a community looking out for, their young, and making sure that everybody in the broader community has the same access to care and also has the possibility of achieving the same excellent outcomes. Absolutely.
Absolutely. I was really encouraged by that. But the particulars of the calculator, they weren't really, they didn't question the numbers or the statistics at all. I think they kind of had a feel for where the problems were already, and the calculator really helped to quantify that feeling.
Mm-hmm. Yeah. From my perspective, one of the reasons why this tool is so powerful is that we all bring our own understanding and experiences to the table, and sometimes it's hard for us to think outside of our own experience and outside of our own box, if you will. And to have something that's objective, like this tool that quantifies, and to a certain level of significance, possible disparities, and then also identifies the number of lives impacted, is a great way to kind of make it more black and white in terms of what's happening in an objective way.
Absolutely.
And Michael, with that being said, it gives a real opening for interpretations as well, along with, you know, viable limitations that we may have within our clinic setting or our community, or working with our multi-D teams to see how we can best target those populations with the highest needs or barriers to address such things as, example, viral load suppression. How do we continue to work to get individuals virally suppressed, which we know that the medications work 100% of the time, but what are the ultimate barriers outside of a person coming to their medical appointment? They're on the medication 100% of the time, but life happens, and life happens to all of us. And if we have those components or questions that we can have at the bottom of our line item to actually still look at, along with the baseline data that we receive, overall we will be able to, you know, meet the deliverables for those persons that have those struggles.
That is an excellent point, and I hadn't even thought about that in terms of, you know, a tool like this can kind of help us go back to square one sometimes and say, wow, you know, we have some holes in our data that we need to come up with a data integrity plan, and then we need to maintain that plan before we can talk about this in a meaningful way. I think that that's an excellent point, too, in terms of the behind-the-scenes process that happens with this type of statistical computation. So I'm looking at the time here, and I'm wondering if perhaps maybe what we could do would be to show a little bit about how to access the TCQ materials, and just to kind of show where they're located. Let me show my monitor 2 here. And if we go to nationalqualitycenter.org and QC activities, training consumers on quality, we can see a couple of things. We have general information about how to apply to the TCQ, but if you click this button, TCQ course materials, it brings you to the slides. And when it says slides.rar.exe, what that is a, come on. There we go. Took some clicking there, but it's downloading. That is a zip file. So if we come over to my downloads, we can see this book here with the up arrow on it. And just by clicking into it, you can click Run and then extract the files. So you can see here I'm extracting it to the same folder location. I'll say yes to all because I did this before. And then the files just go plop right there. So if we look at Module 4 in Day 1, Health Numeracy, this is a really great way to start a conversation with consumers who haven't ever seen data before, or at least you've never presented data to them before. Sometimes it's better not to make assumptions and just to kind of like say, I know that this is going to be pretty basic for some of you, but for those of you for whom this is basic, maybe you can help me keep an eye on, you know, our brothers and sisters in the room who are learning, you know, for the first time, and we can all help each other learn. You know, there's no need to feel insecure if you don't know something, but if you do know something, you should chime in and pipe up and make sure that we can, you know, include everyone in this discussion. This module walks through some basic things. This is a thing that is supposed to help people feel more comfortable that there are people in the country who are illiterate, and that is fine, and that there are people in the country who can't do math, and that's fine. But, you know, this couple might work well together because they can help each other learn how to read and learn how to do math together. So just thinking about, again, like reinforcing that fact that there are ways that we can support each other in our learning processes. But I'm not going to go through every single slide here today, but I do recommend that you download them, especially for those of you who've never shared data with consumers, and just to think about this in terms of, you know, how you might have this type of discussion with people living with HIV. In terms of our work, I think that this slide is one of the more important ones in terms of thinking about, you know, from a clinical quality management standpoint and from a quality culture standpoint, data is cultural competency, right? Like data is how we know what the system is doing, and we kind of know what we need to do within the system to make sure that we can help everybody, and to kind of use language that's familiar with consumers already, and to apply it to clinical quality management insofar as data analysis and data interpretation is concerned, I think is a great way to do that. These slides are, as I said, available for free. It's part of a program that you can send consumers to. As Chuck mentioned, he's been trying to get some folks to attend this training. And yeah, so keep your ears peeled for announcements in the NQC News. We'll definitely be making announcements within the EndDisparities Learning Exchange about the next trainings. And we hope that this training, or if you review this this module of the training and see what's up, that might be a great way to start there. Now, Chuck, if I'm not mistaken, Shelby County, Memphis is Shelby County TGA, right? You're a Part A?
That's correct.
All right, cool. Just wanted to check, because we have you on the line as a Part A, we have Christine on the line who's a Part B for California as a state as a whole, and then we have a couple in C and D folks on the line too. So just so that everyone's kind of aware, like the different perspectives we're coming from, whether we're part of a network or whether we're part of individual agencies. I just wanted to check on that. Okay, so that is the segment that I wanted to show from the day one. Looking at the day two slides, there are also segments that kind of look at building our health numeracy skills. Within the TCQ itself, it's the morning of day two, but you can see that we start to get into more examples, and I think that there is a activity that people can do in terms of getting involved in that discussion. So again, I encourage you to look at these slides and to think about it critically. I'm wondering if there are any questions right now, or maybe now that we have a better sense of who's a Part A, who's a Part B, who's C and D, if there are any questions that you have for each other as participants in terms of how to use this type of training or how to engage NQC. Or whether you'd like to continue engaging each other in conversations as you support each other in this work across the country.
Michael, I'd like to speak on that just briefly. One of the things that we're doing here in the Memphis TGA is really trying to collaborate with the other parts. Like we have providers that receive Part A, B, C, and D. So what I've been doing is reaching out to the other quality managers with the various parts and really just trying to do a better job of communicating with them so that when we approach providers or consumers, that we're kind of speaking the same voice. We're concentrating on the same themes and the same, just kind of in alignment with each other, because otherwise it becomes very confusing. And what are the priorities and what are we supposed to be looking at if we're not communicating amongst ourselves? I think that's really very useful.
That's fabulous. And I know that Nishi and probably to a certain extent Renata too can talk about experience in working within a cross-part system. They're both within the state of Missouri. Nishi's in St. Louis and Renata's on the opposite side in Kansas City. But maybe Nishi, what's that been like in terms of thinking about cross-part interaction within Missouri?
The interaction has been At the beginning, it was a slow go, I would say, and we're at like a moderate level. But the cross-part collaboration has happened because we have a phenomenal team, and our phenomenal team is like our Missouri statewide response team, and it's a collective group of individuals far as like I'm the consumer, we have a manager, data specialist, we have the state, and we have our outstate, which is like AIDS Project of the Ozarks, and then we have Kansas City. So we come together monthly to talk about our aim statement and our mission for our region. And we also include our Ryan White grantees as well as our state representatives to really push and to believe in our quality management plan as it is written. So we use that as our guide. We talk about what worked well, what didn't work well, how can we improve, how we can sustain for sustainability. And we try not to recreate the wheel perspective. We try to still shamelessly based on the tools that we've been given over the last 24 months. Renatus, do you have any feedback or any experiences that, since you've been sitting at the table with us, that you would like to elaborate on? Did we lose him? Hello?
Hello. I see the line is still open, but perhaps stepped away.
Okay.
But I would like to point out, based on your points there, Nishi, you know, I'm just thinking about Christine's situation in a huge state like California that's broken up into various consortia. It sounds familiar, her situation sounds familiar to the situation that you just laid out, Nishi, where you have one state team that's also broken up further into regional areas or consortia, if you will, though they're not consortia, I know, but like it's a similar kind of idea where you have work groups within regions of your state that are acting together and then building up all together to aggregate into a statewide project. Yeah. So since we only, oh, go ahead.
So with that being said, Michael, if Christine is still listening, just trying to find a real good platform in your state that's conducive to all parts, even the sub-grantees, your consumers, your allies, you know, to get that platform built in a small way where you guys can even have maybe an hour meeting just to lay some foundation to plan, and then just utilize some of the flow chart mechanisms that you can use to build a good meeting to have great outcomes. And then it'll just build upon that. And finding that centralized location where people will feel comfortable with meeting over a period of time.
Yes, I'm listening. This is Christine, and thank you so much for all the ideas. Yes, I'm starting with using our regional work groups. We have 4 right now, and I'm trying to see if we can set up a 5th one, again, because of how big the state is. And I'll try and use these work groups as a platform to discuss the statewide plan and present on data or any updates. So, yes, great ideas. Thank you.
I love your choice of word there, Nishi, platform. And I'm thinking about what Chuck was saying when he's saying that they're trying to, you know, build more momentum around cross-part within the Memphis TGA. Chuck, if you could just, you know, kind of like outline what are some of the ideas that you have in terms of having that common ground or platform on which to stand to build this work around. What are some of your thoughts on that? we may have lost Chuck, or let me try unmuting him. Chuck, are you there, sir?
There?
Hey.
Yes, sir.
Hi.
Okay, sorry about that. No, I was just saying so I think we're at the beginning of this process of cross-parts collaboration. We do have a regional quality group that meets in Nashville, and we had just recently joined that group. And there's a couple of individuals from this area on that group as well. But locally, I just really felt it was important because, I would go to, we have some large providers, maybe have, 2,000 clients, and they are, receiving funding from all the different parts. And I would go to them and they'd say, what is it you want us to do? And, Part B wants us to do this, and Part C says this. And so really just that initial step of sitting down with individuals from each part and saying, let's just meet and talk about this and see what it is that we have in common and where we can align our goals. That we're really at the beginning of that process.
Fabulous. Well, I think that it's never too early to start, and that sounds like a wonderful path, to select in terms of getting your journey started. So, kudos.
Thank you.
So I'm looking at the time, and I think it's about time for us to end our discussion today. Sandra, I'm going to send you an email just so that we can have a chance to talk about the calculator tool itself and accessing it and next steps for you there, because I did not forget my promise to you, but I don't want to be disrespectful for other people's time today, if that's okay.
That's perfect. Thank you so much.
Wonderful. Well, on behalf of the National Quality Center, thank you so much for joining our office hours today. I think that it's really important for us to, continue to have these types of informal gatherings to think critically about the application of what we're trying to do here in the EndDisparities Learning Exchange. So thank you very much for joining us and taking time out of your busy days on a Friday to have this conversation with us.
Thanks, Michael.
Thank you.
Have a wonderful day, and we'll hope to see you again very soon.
Thank you, everyone. Have a blessed holiday.
Bye-bye.
Bye-bye.